Today, our topic is overcome complex coronary interventions with the Novel Alveo 0.75 CTO balloon. We are very honored to invite four respected professors from Lebanon and Poland. They are Dr. Charbel Naim, Dr. Catheter, Dr. Jan Kruger, Dr. Greg Girls from Poland. Welcome.
Thank you, Michelle.
Okay.
Thank you, Michelle.
Now, welcome Dr. Charbel Naim to make the first speech challenging case. Welcome.
Thank you, Michelle. Welcome everyone to this exceptional scientific meeting. We'll start with some case presentations. Why is this balloon very important in our daily work? Because at the end it helps save lives. So it helps accomplish procedures. It helps us have a good result, and eventually it helps us to save lives. So the inability to cross the lesion with a balloon is the second most common cause of technical failure, and with the most common cause being the inability to cross the wire. That is a very frustrating event in interventional cardiology. So when you cross the lesion with the wire and you cannot cross further with the balloon. We had presented in PCR 2015 an algorithm to cross non-crossable lesions. And we can see here that the dedicated CTO crossing balloons and over-the-wire balloons are at the forefront of this algorithm. So a very important step if whenever we think that we have an uncrossable lesion, a challenging lesion to cross, we don't want to lose our material. We try and we start with a dedicated CTO crossing balloon, and then what have we techniques to try to cross this lesion. So we present this case of a 60-year-old male who has several risk factors, who was bypassed 10 years ago, presenting with worsening symptoms at minimal exertion and then at rest, with an impaired LV systolic function of 30%, which is new. So on coronary angiogram, we can see he has a occluded graft to the right coronary artery and a chronically occluded right coronary artery. We crossed antegrade with a wire, and we used the Alveo balloon to cross the lesion. Crossing the lesion was successful after and dilatation of the lesion was successful using an Alveo balloon, and we can see implantation of the stents, and at the end we can appreciate a good result, and the final clinical outcome was improved EF, improved symptoms, and the patient is doing well. So Alveo helps treat patients. Alveo helps avoid complex, complicated lesions and help them be treated successfully. So this is in CTO. It is its place is very proven and very well known. However, sometimes we have to use CTO techniques in non-CTO cases. Using Alveo also in complex coronary disease is essential. It is an essential tool on the bench of every cardiac lab, and we'll see why. So this is a 75-year-old male who presented with a non-STEMI. He had previously been treated for a stent on the LAD. We can see that he has a diagonal with two big branches. We did the PCI for this, and after implanting a stent in the first branch of the diagonal, we couldn't cross with a non-compliant and a compliant balloon of different marks and calibers. However, the alveo, we can see the smooth passage of the alveo. After pre-dilatation, we had implanted another stent, and we did a final case, and the result is excellent, as you see. So even in non-CTO cases, this CTO balloon works effectively, and it helps us accomplish and continue the case. Further, we present another case where we use this alveo balloon. This is a non-STEMI, and a patient who had previous CABG, previous stent of a graft to the proximal LAD. Here we can appreciate that the proximal LAD, the saphenous graft to the proximal LAD is occluded at the ostium at the level of the previously implanted stent. Its engagement was difficult, its wire passage was difficult. We can see a small stump. We crossed after some manipulation. However, only the alveo could cross the lesion, and after pre-dilatation, we had good flow, and at the end we implanted a stent, we post-dilated, and we had an excellent result. The patient is also doing very well. So dedicated CTO crossing balloons are at the forefront of the algorithm for crossing uncrossable lesions. So I prefer that we start with these with the alveo and the CTO crossing balloon in every challenging and difficult case as a baseline. So alveo is a CTO crossing catheter balloon. We'll talk a little bit about the product information. It's 0.75 millimeters. It's the world's smallest profile PCI balloon catheter. It's always the first choice. We'll talk about the 0.75, its features, its competitive overview, and later the manufacturer will tell us about the ordering and stuff. It has the smallest high-pressure CTO balloon catheter in the world. It's specifically designed for crossing complex lesions and chronic CTO, as well as tracking tortuous anatomy. It combines several innovative technologies in one. So the diameter of the balloon varies between 0.75 and 2 millimeters. The length between 5 and 30 millimeters. The nominal pressure is 10. What's important is that the rated burst pressure is 20 atmosphere. Average burst pressure is more than 28 atmosphere. It's a semi-compliant balloon. What is very important for the 0.75 and 1 millimeter balloon that it is bifold. So it's a slick balloon that can pass in difficult lesions without being stuck in these lesions. And this bifold confers a very important property for the alveo. The tip length is 1.5 millimeter for the 0.75 and 1.75 millimeter and 2.0 for the 2 millimeter balloons. Its proximal shaft is 1.9 French and 2 French for the 1.75 2 millimeter balloon. The working length is 140 centimeters. The guide wire it goes over 0.014 inch. The guiding catheter, it's compatible with 5 French, and the coating is a slider hydrophilic from tip to exit marker. It's hydrophobic coating for guide wire lumen. So it has a proprietary balanced distal tip technology. It's a new balloon material design, and it has a enhanced shaft design. The material choice and design are important for optimal tip crossing and tracking. We can see the difference between alveo and river, between pre and the kiss and the post, and we can see that alveo has a better tip technology. We can also notice that the alveo is smaller than all other balloons, at times emerge as the Sprinter legend. Alveo always has a optimized distal laser welding technology. It's a proprietary for the company. The distal laser welding technology eliminates hardness and maintains distal tip flexibility. So we can see here that there's no transition in the distal laser welding, resulting in smallest crossing profile. The optimized distal laser welding technology offers no transition into distal laser welding, resulting in the smallest crossing profile among all the balloons. We can see that the Alveo has the best tip profile as compared to Arc Times, Emerge, Across CTO, Sprinter, and River. Here we can see the Alveo tip. Here we can notice that among all the other balloons, the Alveo has the smallest crossing profile. The tip profile is better than Arc Times and better than the River, better than Emerge, better than the Across Sprinter Legend. So Alveo is made of robust balloon material that allows for high pressures and kink resistance with an average burst pressure of 28 atmosphere, and it has the highest burst rate pressure among all the other balloons. So it allows better dilatation of lesion with a safer dilatation. So robust balloon material allows for high pressures and kink resistance. Even in heavily calcified lesions, the burst comparison with increasing standard sandpaper roughness. This is a bench testing, and it has been proven on the bench with as you see here. So the proprietary balloon forming technology results in balanced flexibility and smallest balloon profile as compared to all other CTO crossing balloons like Alveo, Arc Times, Emerge, Across Sprinter, and River again. The optimized balloon material and balloon folding technology results in superior rewrap for CTO lesion reentry. Optimized distal shaft with 2.2 French is compatible with other devices for CTO and 6 French guiding catheters. The 2.2 French distal shaft is used for improved trackability. It has enhanced inner lumen to eliminate guide wire friction and to increase pushability. And this we can see often with longer cases that we suffer a lot from guide wire friction with other balloons. So it has a very good push force. We can see that Alveo has the best pushing force among all the other CTO balloons. The proximal shaft design, the spiral cut hypotube design for smooth transition and high column strength results in optimal delivery of the balloon catheter. So the Alveo combines several innovative technologies in one. The leading laser processing technology ensures a smooth, tapered, ultra-low tip profile of 0.0154 inch, which supports superior crossability of complex lesion, and with a rated burst pressure of 20 atmospheres offers adequate dilatation of the lesion. And we can see here its comparison with other CTO balloons, and we can notice its superiority. Thank you very much. We leave the floor to you, Michelle.
Thank you. Thank you. Let me share. Yeah. Okay. Thank you for Dr. Charbel. Excellent case sharing and introduce a real high pressure CTO balloon for everyone. And as we all know, we are facing more and more CTO challenging cases. And latest and improved CTO products become more and more important. And it will increase the surgery, the pressure, the successful of the procedure. And any question from our audience? You can share the chat board.
Very good case. Thank you for presenting.
Yeah, and I see one question from the chat board. Except from the lesion dilation or modification, can Alveo be used as an ankle balloon or any other functions in a CTO procedure?
Yes, definitely. It's an excellent balloon to use in all types of complex procedures. So one of the main issues with CTOs is that you need always an excellent support, and you can use it as an anchoring balloon. You can use it subintimally, as we will see, I think, in further presentations during this session. It has a very well apposition, and it can be used easily in all kinds of complex cases.
Thanks for our experts and all the audience again. And for more information, you can search BrosMed medical website. And any question, you also can contact us via email, sales@brosmed.com. Thank you.